Congenital insensitivity to pain. What is congenital insensitivity to pain? Well, it's a rare, autosomal, recessive hereditary neuropathy condition that's characterized with being unable to feel any pain, temperature, or sometimes even soft touch. Many people with CIP also have anhidrosis, which is characterized by not being able to sweat due to the sweat glands being inactive, or because one doesn't have sweat glands at all. And this is a rare inherited condition, but it can obviously happen. In a lot of cases, CIP causes intellectual disabilities that include non-progressive cognitive delays, but they still have the normal motor movement and behavior as well as strength. Their problem often lies in constant major injuries, such as broken bones that they're unaware of, or large damaging sores. We will look at 2 of the 4 case studies of young children with CIPA discussed by Nahla R et al. In 2012. And the top image shows a young 13-year-old girl who had a harmful deformity in her heel, which was amputated. 3 weeks later, though, she was back in the clinic due to massive cellulitis that started at the site of her surgery but progressed all the way to her knee because she couldn't feel any of the pain. The bottom image is a 12-year-old boy, and he has this large heel sore which was measured of 10 millimeters by 10 millimeters because he couldn't feel any of the pain, which allowed for this injury to get so severe. All of the four cases that Nahla et al. In 2012 looked at had a few things in common. There was osteolysis, which is a condition where bone tissue is destroyed, and osteomyelitis, which is inflammation of swelling in the bone, mental retardation, chronic self-mutilation, especially in the fingertip area, as I have an image describing what these children do. And interestingly, they were all a product of a consanguineous couple, which demonstrates how it's a recessive hereditary condition because they were related, so they must have had the same genes which contributed to this condition. The behavioral or cognitive manifestations of this disorder is that young children with CIPA may bite their tongue, fingers, or lips, which causes severe damage and can sometimes lead to amputations. According to the Jamaican Hospital Center, it's usually obvious when people with CIPA come in to be diagnosed because, as I mentioned, they also often have large damaging injuries or sores. The anhidrosis part of it is damaging to not only the brain but the body because the inability to release sweat from the gland when the patient's temperature rises can cause high fevers known as hyperexia, heat stroke, and seizures, which can all be fatal. When the brain starts to overheat with the body, it leads to mental fog because the nerve fibers stop working properly. And when these fibers cannot make connections, the messages cannot be relayed throughout the brain, which causes mental and physical fatigue, weakness, and problems with balance and vision. Along with these physiological manifestations of CIPA, it can disrupt sleep, the feeling of self-actualization, emotional well-being, sexual activity, nutrition, and mobility.
Hi there, my name is Starla, and I'm going to be presenting the genetics and neural basis of CIPA, also known as congenital insensitivity to pain and anhidrosis. So CIPA is an autosomal recessive gene, meaning that the child inherits one copy of a mutated or changed gene from each parent. And typically, those parents do not show signs of having CIPA, but it gets passed on to the next generation of the child. It does affect the central nervous system, and they call it a form of peripheral neuropathy because it affects the peripheral nervous system, which is what connects the brain and spinal cord to muscles and cells that detect sensations such as touch, smell, and pain. And because there's some sort of mutation on the CYPA gene, it doesn't allow for the person who has it to be able to sense pain. Also, I wanted to discuss what mutation is, because it's important to understand a mutated gene is it's when a gene variant prevents one or more proteins from working correctly. Therefore, when a variant alters the protein, it can lead to a genetic disorder. As I said previously, the condition is inherited in an autosomal recessive pattern. It means both copies of the gene in each cell have mutations, and both parents carry a copy of the mutated gene, although typically they do not show signs or symptoms of having the gene. CYPA is created by mutations in voltage-gated sodium channels, mostly on the SC9A and SCN11A, which causes CIPA. I thought it was important to note the SCN9A gene plays an important role because it's important for instructions for making sodium channels. And these channels provide transportation of positively charged atoms into cells. And when they are messed up, they change the nociceptors, which is responsible for transmitting pain reception. And so if this isn't working correctly, and there's a mutation sitting on that gene, then it doesn't allow the body to get the signal that there's pain happening, which is why so many of the people who get or actually do end up with CIPA, they end up not making it past childhood because they don't know that they're hurt, either internally or externally, and it can be oftentimes life-threatening. So this is just a picture of what the migration to DRG and then mutation looks like, to kind of give a visual of how the gene looks in the human body. This concludes my portion of CIPA, and I will pass it on to Emily. Thank you.
Hello, so this slide will be covering the developmental course of CIP. So when someone finds out that they have CIP, it is most likely because they inherited it at birth, and this will be due to the person's parents both having a mutated copy of the gene, but for them it lays dormant and they actually have no idea that they may have it because it doesn't have any effect on them and it doesn't have any symptoms. CIP will affect the peripheral nervous system, which means that they will have lack to no sweating, and the effect from this can be anhidrosis. And another effect of the peripheral system can be loss of smell and loss of bladder control. The effects from these complications are infections from wounds and corneal abrasions due to low production of tears. Unfortunately, a person with CIP will have a reduced lifespan compared to the average adult, because of the repeated injuries that they had throughout their life. To the right here, this is going to be an image of the autosomal recessive pattern that I was describing earlier. So this is when the mother and father have are carriers for the gene, and so when they have children, it affects them in different ways. So the first child will be fully affected. The second and third are carriers, and then the fourth is going to be unaffected. This isn't the exact pattern that it would happen in, but this is about the percentage of what the child might be born with.
Hi guys, I'll be talking about the treatment portion for CIP. My name is Nahla R and I am in group 4. So treatment. Currently there is no cure for CIPA patients suffering from this condition. Patients usually have to learn how to manage this condition. Managing this condition in children requires a lot of effort on the parent, especially in the initial phase of the diagnosis. So the parent would be required to childproof the patient's home to prevent injuries, provide any kind of protective gear, for example, such as eyewear, teach the child to get medical help whenever they see injuries or blood and recognize the sight of blood as a sign of danger. Also to get physical therapy to help deal with joint deterioration, and if possible, moving or living in a cooler climate to help the patient avoid overheating, and also using a timer on the phone or watch to remind them to use the restroom, because again, they have no feeling or no physical feeling. So managing CIP in adults is kind of similar to the management of CIP in children, just at this stage they're more aware of how to manage their body and what to look for. So it's also crucial to be controlling body temperature, preventing self-injury, treating orthopedic issues promptly, and regulating the body temperature during surgeries. For an example, this is my works cited page, and also in conclusion to this presentation, CIP is a rare condition in which an individual cannot feel physical pain. It is a dangerous condition in which is also common for people with this disorder to die from, especially in childhood, due to injuries or illness that go unnoticed. During my research, I also found that one of the conditions that's children with this condition die from is actually from burns. And so I think based on everything that I've presented, advocacy for a child that has this disorder is crucial. Self-education and educating the patient and the child. And that concludes my portion for the treatment part. Thank you so much.